Every single human being on earth began life through one extraordinary process, birth. But what really happens during normal delivery? How does the mother's body know exactly what to do? Why are contractions painful? And how can a tiny baby pass through the birth canal safely? Today we enter the labor room to witness one of the nature's most powerful biological events, normal vaginal delivery. By 37 to 40 weeks, the baby is considered full term. Inside the uterus, the baby prepares for delivery by rotating into the ideal position, head down. This is called cephalic presentation. The mother's hormones begin changing dramatically. Estrogen rises, oxytocin receptors increase, and the cervix, the gateway between the uterus and vagina, slowly softens and prepare to open. Doctors call this process cervical ripening. The exact trigger for labor is still one of medicine's greatest mysteries, but scientists believe the baby itself may send chemical signals when fully developed. The hormone oxytocin now begins stimulating powerful uterine contractions. Imagine the uterus as a giant muscular balloon, squeezing rhythmically from top to bottom. Each contraction pushes the baby lower into the birth canal. These contractions are painful but incredibly important. They are the engine of childbirth. The first stage of labor begins when regular contractions start and ends when the cervix is fully dilated at 10 centimeters. This stage has three phases. The early phase contractions are mild and irregular. The cervix opens slowly from 0 to around 4 centimeters. Next comes active labor. Contractions become stronger, longer, and closer together. The cervix dilates rapidly from 4 to 7 centimeters. Finally comes transition, the most intense phase. Contractions may occur every 2 minutes. The cervix reaches full dilation at 10 centimeters. During this time, doctors continuously monitor the baby's heartbeat to ensure the baby is tolerating labor safely. The mother may feel pressure, shaking, sweating, nausea, and exhaustion. Yet the baby continues working astonishingly precision. Surrounding the baby is an amniotic sac, a protective fluid-filled membrane. During labor, this sac may rupture naturally. This is commonly called the water breaking. The amniotic fluid cushions the baby and helps maintain temperature and protection during pregnancy. Once the membrane ruptures, labor often progresses more rapidly. Now begins the second stage of labor, the pushing phase. With each contraction, the mother pushes using her abdominal muscles while the uterus contracts simultaneously. The baby must now perform an incredible sequence of movements called the cardinal movements of labor. First engagement, the baby's head enters the pelvis. The flexion, the chin tucks towards the chest to fit through the narrow birth canal. Next becomes internal rotation. The baby rotates carefully to align with the mother's pelvic anatomy. As pressure increases, the top of the baby's head becomes visible at vaginal opening. This is called crowning. At this moment, the vaginal tissue stretches dramatically. Doctors and nurses guide the mother to push carefully to reduce tearing. Finally, the head emerges. One shoulder appears, then the other, and within seconds, the entire body slides into the world. For 9 months, the placenta supplied oxygen through the umbilical cord, but now the baby must breathe independently for the very first time. As air enters the lungs, the fluid is cleared from the airways. The newborn cries, a powerful sign that lungs are expanding successfully. The umbilical cord is clamped and cut. And then comes one of the most emotional moments in medicine, skin to skin contact between mother and baby. Even after baby is born, labor is not complete yet. The uterus continues contracting to dispatch, detach, and expel the placenta. This is called the third stage of labor. These contractions are extremely important because they compress blood vessels and reduce bleeding. Doctors carefully examine the placenta afterward to ensure it has been delivered completely. Immediately after birth, the mother's body begins recovery. Oxytocin continues helping the uterus contract back toward its normal size. Breastfeeding stimulates additional oxytocin release, strengthening the bond between mother and child while also reducing postpartum bleeding. Meanwhile, doctors monitor both mother and newborn carefully during the first hours after delivery. Normal delivery is far more than a medical procedure. It is perfectly coordinated symphony of hormones, muscles, anatomy, and human resilience. Every contraction, every push, every heartbeat brings new life into the world. And despite modern technology, childbirth remains one of the most extraordinary miracles biology has ever created. The human body is incredible. Subscribe for more medical education and 3D anatomy videos. Thank you.